Okay. Good morning, everybody. Good to see you all in the public. We're going to do a mini dive into the home contractor bill, S
Eight.
H-157. The bill has not gotten to the Senate yet, and it's a little unclear whether this committee will have jurisdiction over it or government operations will have primary jurisdiction. And so we're cutting back on our uh, time on this bill this morning because we have so many other new things that have come our way. But we will hear from our legislative counsel and the House reporter, and then we'll move on to ARPA. So, good morning, Chip. Welcome. Nice to see you. You're muted. You're still muted.
Yeah, sorry.
Okay.
Good morning, everyone. And it's a pleasure to be here this morning.
So you've heard a little bit about cutting back a little bit on the bill. The floor is yours to tell us whatever you'd like to, but we really like to focus on the contract terms and the discussions you had and what the House's actions were on those, as opposed to, the differences between registration, certification, and licensing. But however you want to present it is okay with us. Maybe figure about 15 minutes or so or doing that, and then we'll hear from David Hall.
Okay. So last year discussions on it was S-136, I guess we were discussing last year. And the at that point, we came down with $1,000 to register and $1,000 for a contract in order to trigger a written contract. This year under discussion, and OPR was in agreement that our committee went to $2,500. We thought it was important to keep both levels, both requirements the same. We had a lot of discussion on it, and it seemed to make sense if you were going to be a registered contractor at $2,500 at a job that requires 25 or that would pay $2,500 for and time and materials, then it would make sense that that should trigger a written contract as well. OPR told us that a written contract is what I call, from my criminal defense background, is evidence. It would support in writing the agreement that were made between the parties, and it would actually cause or enhance their ability to step in on any enforcement issues that may happen as a result of a complaint against the contractor. The Ways and Means Committee took the bill. They were in possession of it. And through their discussion, without taking a lot of evidence, and our committee had somewhat of a difficult time with it, they raised one amount, the amount to register, to $3,500, and they left the written contract at $2,500. Again, after a considerable amount of discussion, we decided that, again, that they should be the same, that should be the same trigger. So they did go back and they resubmitted a substitute amendment with $3,500 for each that would trigger both registration and a written contract. So that amendment was presented and it was passed. So that's how it became $3,500 on each.
So can I just interrupt for a
Yes, you
second?
can. Absolutely.
You said $3,500 to register. That's not a registration fee. That's
correct.
What do you mean when you say $3,500 to register?
I'm sorry, I wasn't clear about that. So anyone who's in the business or not, actually, who takes a job, a construction or home improvement job, that the cost is $3,500 in time and materials. That's the job estimate. That's the job cost. So that is what triggers the registration. If a contractor takes a job and that is worth over $3,500 in time and materials, then they're required to register from that point on. It's not by the job. It's not cumulative. It's just that they would be required to register. Upon that registration, they could take $5, $10, $15,000 jobs throughout the year, and be registered, and that would be it. In the same respect, that $3,500 in time and material cost of the job would trigger a requirement for a written contract between the parties.
Now,
Okay.
I just need to compare that with how it left us.
1,000, I think, wasn't it?
We ended up being, I think, 1,000. It was registration for an individual was $75.
That's the fee. Yes, correct.
Yep. And renewal. And for a business organization, it was $250. And renewals were, state certifications were $75, which is a little different. But we ended up at 1,000, I believe, but it was a lot less than this. The threshold was considerably less than this.
That's correct. Again, we voted the original bill out of 2,500 at 9.2, and then Ways and Means raised it to $3,500, and that's the way it went to the House with that amendment. The amendment passed, so that's the status of the bill at this time.
And my understanding is that if you don't register, it doesn't mean you can't do the work. It's just you can't hold yourself out as being registered.
Well, that's correct, and yes, there is the only trigger for someone who fails to register is if a complaint is filed. At that point, OPR would be able to step in, and their enforcement division would be able to look into the matter and possibly prosecute any kind of fraud or job walk off or anything of that nature. Otherwise, someone who doesn't register and takes jobs, there is no real enforcement arm to reach out and to that on that person. I kept saying the other day when I was reporting the bill, this is an enhancement bill. It doesn't really use a hammer. It tries to use a carrot, so that when contractors begin to register, and this JFO thought about 50% plus on the first year contractors would register. So once this list is up and running and the public is made aware of it, OPR has a plan to make that happen also. We heard from a friend of mine who is an outreach person in the Northeast Kingdom. They're ready to get the word out through agencies and advocacy groups. So once a Vermont consumer knows that this registration exists, they are more likely to go to that to find a reliable contractor.
Right.
And that the increase of work that those contractors would get would be the enhancement to bring other contractors in who very likely would be losing work to these reliable contractors that are on the list.
Right.
That's how that's the goal of the bill. That's what's anticipated to happen.
Right.
Can you talk a little bit about the insurance requirement and anything more you can say about what's required in the contract, if anything?
Sure. The contract is spelled out in 55 section.
And my understanding is there will be like templates or sample.
OPR has told us that they will get a contract. They don't have it right now, but they will have a contract online, which can be downloaded and fill in the blanks kind of thing. We did have a few changes in the contract when, at this point, it was brought up in our committee that a lot of contractors work on estimates. They're not actually signed contractors, but someone comes to your house and say, I'll build your deck for $8,000. And that's an agreement and a handshake, and that works often. That works a lot of the time. But when a contract is negotiated, section III of I can't find the section 50 5502 maybe, or no, 50. I can't find the section right off. That would actually suffice, that estimate under this section, which would require no maximum estimate, but solely a basis of an agreement of time and materials which would it would result in an estimate. If you have someone to come up and say, I'll build your deck for $8,000, you can put that in writing. What would be required as well as an agreement of a commencement and completion date. There's a few other pieces that would go into the contract. But basically, this contract, OPR will have a contract template to be able to download for contractors to be able to fill in the blanks and fill the requirements.
And insurance,
if your committee gets this bill, you should hear from the insurance company. We heard from the insurance company, and we didn't make any changes in this. I did hear that the $300,000 per job and $1 million cumulative would cost between $400 and $650 a year for a sole practitioner. So that is, that's where that stands. That and I mean, it's minimum liability insurance. It makes sense, when you're working on this. I mean, I mentioned I worked 40 plus years ago as a contractor up here, and it was always a handshake and climb up on the roof and hope for the best. So I think those days are gone. And so I think it makes sense to have minimal liability coverage for both the consumer and the contractor.
Yeah.
You say liability coverage, so it protects against somebody getting hurt on the job, but does it protect against a contract violation, like for instance, if it's poor performance or delayed performance, or they build a roof and the roof leaks, does the insurance cover the losses to the claimant, or is that independent of the insurance?
Well, this bill is independent of the insurance. There is no way in this bill to make a consumer whole as a result of some sort of fraud or incompetent work. What it would do is, upon a complaint that contractor did a bad job on a roof and it leaked, that would cause OPR to possibly investigate and adjudicate that individual if it was fraudulent in particular, and to adjudicate that individual, and then make some sort of an adjustment on the list. If the individual is registered, they can put make a note that there was a complaint against them, and they can actually note that that complaint resulted in adjudication, which removes them from the list. Now, the list, it wouldn't remove the name of the person from the list. What it would do is put sort of an asterisk on that name, saying that there had been a complaint or some dissatisfaction with their work, and that would they would stay on the list. So it would be sort of a warning as such.
May I ask a question regarding that warning? Does the warning, in effect, it's putting a red letter next to that particular contractor? One, must there be, in effect, an adjudicated finding of wrongdoing? And is there any method of appeal from by the contractor?
The answer is yes, Senator. The OPR has a staff of investigators, attorneys, and hearing officers. So basically, if a complaint is made and it is screened into OPR, there will be an advisor, and there's an advisor in the office of OPR that would advise a prosecutorial movement on that. Upon some sort of prosecution, the contractor or the defendant in this case would have the right to a full hearing and due process on that complaint. The Office of Professional Regulation would then issue an order based on that complaint, and if they were adjudicated For instance, fraud is what is primarily considered in this. An individual comes to a house, takes a $5,000 deposit, and disappears. That would cause that would be a fraud complaint, and that would cause, as you call it, a red letter next to the name of that individual. But it would be based on adjudication with a full due process hearing for the individual and the ability to present evidence and such. And that again, the contract comes into play in some respect because it outlines what the expectations of both parties are and allows them to, it allows OPR to use that as evidence as far as, or rather than he said, she said kind of situation, which is very difficult to work through an adjudication.
Well, in terms of how,
And
what kinds of complaints could be brought against the contractor? Fraud, not doing the job as defined in the contract, walking off with the money, those are pretty clear cut. Was there any discussion of simply consumers who were dissatisfied with the work, dissatisfied aesthetically, they don't consider it to be done in a workmanlike manner, whereas the contractor says, I followed, all industry standards. And, did you really just consider the possibilities of the he said, she said arguments that are not fraudulent in nature?
yes, we did. I mean, there's a definite separation between that. I think what else would be captioned in a complaint would be grossly incompetent work. I think if someone installed insulation and vapor barriers in a home and it resulted in black mold and wood rot, that would be a legitimate complaint to be made. It's gross incompetence. When a contractor or when a consumer is dissatisfied with the work, that's why the complaint is screened before the adjudication process starts. And it's the hopes of that, or it was told to us by OPR that process would screen out complaints that were not legitimate.
Now, you mentioned that everyone does not have to register, though. The registration process is essentially a voluntary one, and OPR would only get involved in the case of someone who is not registered upon receipt of a complaint. Is there anything that requires the unregistered contractor to cooperate, produce records, or do anything else if they're not registered and a complaint is made? Would they have to cooperate with the investigation, in other words?
Well, if they can be found, I mean, oftentimes, they're gone. But I think OPR has the ability in their adjudication process to bring a contractor in and move forward. So if that contractor was not registered, then I think, again, it would be a mark that an unregistered complaint was adjudicated on an unregistered contractor, and they would appear on the list so that consumers that are consulting the list would know that this contractor was not particularly reliable. That's why it's an incentive process. I think that it will take a little bit of time, but I think ultimately contractors will see the advantage of being on the registration. I think they will get more work as a result of it. A neighbor of mine's house burned down. She can't find anyone to build a new house for her. So I think going to the list will allow Vermont consumers to trust that the person that they are looking to hire is reliable. Now, that being said, there is no requirement for competency in this bill. So when a consumer does consult with a contractor, then they would be expected to do an interview process to assure that that contractor is capable of doing what they're saying they would. I mean, that's certainly what I would do. So I think that would be part of it.
Right.
So the department has no ability to go back and from an enforcement standpoint, it can't make the consumer whole. And aside from putting the contractor on the bad list, is there anything else that they can do?
Well, again, this is more of a protection than a recovery situation. So again, when there's a full list of contractors that Vermont consumers can go to, the idea is that they will screen out the bad actors. The good actors will be on the list. Therefore, the Vermont consumer will be safer to call on contractors that are on the list and avoid fraud and deception and incompetent work. Then we go to the certifications. The requirement or OPR is assigned to begin their certification process with energy efficiency, because there is an eye to energy efficiency in this bill, and and there are energy efficiency standards that are codified in law in Vermont, and it was found that many of them are not, many contractors are not in tune with them or know about them or don't abide by them. So again, when you offer a certification that this contractor has a certification in energy efficiency or weatherization, again, that enhances the ability of the consumer to be able to call on a reliable contractor who now is certified by OPR to be able to do the work that you're looking to. If you're looking to weatherize your home, looking at that they're competent to do the work that you're looking for. So again, that's another piece that will help the Vermont consumer.
And the registration would list all the certifications a contractor would have. As I recall, the Vermont Builders Association was very supportive of this. They felt it enhanced the professional aspect of their business. And so contractors in good standing would be listed, registered, and then under each name or under each business, they'd have all the things they are certified to do, all the specialities, all the areas they've been specially certified in, whether it's green construction, whether it's got some kind of specific, skill that they've learned. Lots of those have their own certification programs. OPR isn't certifying them all. They're often certified within the industry by whoever is teaching that skill or talent to a contractor. So the plus is that they would all be registered in one place. That's a go-to place. People would, as they research contractors to do this work. And then all the sub-certifications, help advertise their abilities as a contractor.
That's correct.
So let me apologize to say that, I asked Chip to jump into the contract and the thresholds. But when we took up this bill a couple of years ago, we spent a lot of time with the Attorney General highlighting the fact that this was either the number one or number two consumer complaint they faced, and we were a real outlier compared to the rest of the country in not having any kind of regulatory framework for this profession. And I would assume, and this, this may be where government operations is better equipped than we are, that the Attorney General's enforcement powers over people who are non-registered still exists in terms of consumer fraud complaints and their investigations as well. So I would just, before we move on to David Hall briefly, Chip, can you just go back to the beginning and what you heard as the need for this bill? And did you hear from the Attorney General's office? I think it was Chris Curtis or Charity Clark, in terms of the problems that Vermonters were facing in this area, and give us some examples of those?
Well, I can. Title 13, subsection 1029 is consumer fraud statute. My experience in the criminal justice system tells us that those cases are often not adjudicated. Police have a difficult time investigating them. They are prosecuted. In one case in Orleans County, we had four complaints against one contractor. So oftentimes plea agreements will result in dismissal of some of those charges, which result in the inability to collect any damages as far as restitution goes. And overwhelmingly, I found that older Vermonters were the targets of these home improvement scams. So, everything that most of what we reviewed was the Sunrise Report. And the Sunrise Report reported that there is a what they call a narrow but significant band of home improvement fraud and deception. That there is no current regulation whatsoever in the state of Vermont. Only one of 8 states in the country that has absolutely no regulation. So regulation is the lightest touch. It's not licensure, and it just requires the payment of a fee to be on the list, and that's about it. And to have minimum liability insurance. So that covers just about everything that it had. And repeatedly, OPR found in their public hearings and through their stakeholders that there was a danger to the public, that home improvement fraud can render a home uninhabitable, and force a Vermont consumer out of their home as a result of that. And we heard from a disabled person last year when we were taking testimony, hired a contractor, stopped coming to work, he stopped paying him, contractor left him in the disabled Vermonter in the hole for $5,000 and having to have someone else finish their job, hire another contractor to finish the job. This year we heard from a young professional moved his house, his wife and 2 children to Burlington, bought a house, needed repair, hired a contractor. Contractor did work that was not up to code, got into a total mess, and he lost $10,000 as a result of this. So this is happening consistently enough for OPR, after significant time and research and hearing from stakeholders, to determine that there is a danger to the public that in respect to home improvement fraud.
Right. We heard the same thing 2 years ago, but it was a more compelling. Chris Curtis testified that it was one of their top complaints in consumer protection division.
It's in the top 10.
Yeah, in the top 10, and that the range of work where the most complaints were made were between $1,000 and $7,500. So it that's why it's curious about your very high threshold of 3,500. It is extremely high, and this is the lightest touch we could do. And most states license contractors because of the investment consumers make in their homes. It's their biggest asset. So here we are not protecting Vermonters in their homes, which are their biggest asset. And we protect all sorts of other assets that are less important to people.
It was mentioned at one of the hearings that Vermont licenses who can paint fingernails, but not who can work on the most valuable asset that you have. So, I mean, that was a really good comparison, and I used it in my report. In fact, I have some figures here if you're interested. The survey that was done by OPR between 2012 and 2017 had 587 complaints against it. Now, we don't have a figure as to how many were adjudicated, but it represented a loss to Vermont consumers in excess of $3.1 million.
Yeah.
Let's see. 61%, 357 of those complaints, 61% were damages under $5,000. So that's sort of your handy person area of work. 413 of those 587 complaints, or 70%, were damages under $10,000. Now we're getting a little bit more into it. 45% of complaints were work on residential dwellings. Only 18 complaints resulted in projects over $40,000, and a significant, again, on the deposit piece of this bill is 263 of those complaints were about deposits. In other words, contractors taking deposits and not fulfilling their obligations.
I think Keisha has a question.
Yes.
Go ahead, Senator Rahm.
Thanks. Good to see you, Chip. I'm generally a supporter of this bill. I'm just curious, if you heard about what other states do and the pros and cons of comparing this to the kind of private social accountability systems. I mean, a lot of people will leave reviews on Google search engines, et cetera. And this sounds a lot better because there's professional adjudication and it's, a lot more sound instead of you just have a vendetta against the person. But, we still have to defend, like, why is this better than Angie's List or Google search or, other private mechanisms? And how does this compare to what other states do?
Well, certainly heard that there are a fair amount of Vermonters who are not internet savvy or don't have the capacity or whatever. So in this respect, OPR can do this offline as well. I mean, you can call and visit, and there are a few means of making contact. But having every Vermont, well, hopefully every Vermont contractor in one list, as Senator Clarkson said, with certifications. Now, the issue of excavators came up. Now, of course, septic systems are now regulated by ANR, and the cost of those have gone up significantly since regulated by them. So, if an excavator has a certification in wastewater excavation, that's a real benefit at this point, because if you got a guy with a backhoe that comes up and says, "Oh, sure, I'll put your septic system right here," you can really have a problem, significant problem, having that system pass. So having having a one list with possible certifications in one place, I think is an advantage over Google searches, which sometimes can get frustrating. I mean, you go the wrong direction 2 or 3 times, and
and Keisha, actually 2 years ago, we addressed this. We heard that people stack those reviews.
Yes.
And that it's very easy to manipulate those reviews, and that one contractor had a whole bunch of friends just call in and say how great he was, and he was awful, and he ended up absconding with a whole bunch of money from one of the Addison County witnesses we heard from. So sadly, the OPR is trusted. OPR is not able to be manipulated in the same fashion, and those are subject to public manipulation too. So they aren't as trustworthy as OPR. OPR is great. And we're one of the only states that don't license contractors. I mean, most states have a much heavier regulation. And this is a very light touch start, we felt 2 years ago, and a great way to market contractors, have all those certifications in one place. Anyway,
I think one thing is,
can I interrupt?
the opposite. Oh, sorry. Go ahead.
I just, I want to come to the end of this
Yeah.
if we can, until we get if and when we get the bill. I don't,
Right.
we need to debate the merits of it right now. Keisha, go ahead with your question. I have one question for Chip, and then I want to move to David Hall quickly, and then we have several witnesses on 159 waiting already. So.
Well, it was a question about education around the registry, because the opposite can be true, where most people go to Google search and it doesn't automatically pop up and say there's a registry in the state so that you can ensure quality, et cetera. So, it's also helpful to make sure we educate people if we do this. And I didn't know if that was a discussion about how OPR will educate people so that they know this is available if they're more inclined to the internet than to sort of look on government websites.
We did have that discussion, or I did, with OPR. What they told us is they are prepared to use multimedia, newsprint, social media, reach out to police departments, state's attorney's office, the attorney general's office, and all advocacy agencies, and to get the word out. So, my interest was in older Vermonters, and I mentioned it in the Older Vermonters Caucus, that senior centers can make this information available as well, because you find many seniors who are living in their homes don't realize that their home needs a roof, and that is the prime fraud. They're the prime targets of fraud on roofing. When somebody comes to your house, "Oh, you have a beautiful house, but you need a new roof." "Oh, okay, well, we'll do it for $10,000. Give me $5,000 and I'll disappear forever." That's kind of the way it works.
One question I have, Chip, before you move on, is I think one of the issues, even if we don't get the bill, but we would want to weigh in on, is the 1,000 versus 2,500 versus 3,500. is there anything you could point to in your workup as to why you came up with 2,500, or is that more of a political thing where you thought that was most acceptable to the House, or is there some documentation or numbers that show why you landed at 2,500?
Well, there's no documentation. That we did have a lot of conversation in committee about it, along with Lauren, who was there representing OPR. And you know, when I think OPR realized that 1,000 was a little low at that point, and so all of our discussion was surrounding the benefits of having a $2,500 limit on both those accounts for registration and contractor. So that was, there was a lot of discussion. There was no this year. There was no one in favor of $1,000 in the committee. Actually, some wanted it higher. We lost a vote from one member who was suggesting it be $5,000. That didn't gain any favor whatsoever. And again, we passed the $2,500 mark out 9-2. And one of those no votes was an opposition to the bill from the start.
Okay. Representative Troyer, thank you very much for being here. Stay tuned. I know the Senate has a great interest in seeing this move forward this year. So
I as well, Senator Sorokin. I think this is a strong consumer protection bill. We got some pushback that it wasn't, but I believe it is. I believe Vermonters will be better protected against home improvement fraud and incompetency as a result of this.
Chip, would you be kind enough to send me your floor speech
And
the figures that you just shared?
They're all in my floor speech.
Thank
I will send it if you wish to circulate.
I would wish it. Keisha and I also serve on GovOps.
Okay.
It was not in vain that you took to it.
Well, thanks for having me, folks, and have a good day.
Yeah, enjoy.
So I'm going to move off this topic. So I don't think we need David to walk us through the bill, but David, hopefully you can stick around because we're going to move on to 159 and other areas where I'm sure you're going to be directly involved with. We're playing this on the fly a little bit in terms of who we can get in on short notice. And I noticed that Beth Fastiggi's here, and I think her testimony probably will be brief. This deals with the Northern Borders section of 159. We talked about a little bit yesterday. And that section, if you have your bill, I think it's section 5, labeled group insurance for state employees, salary deductions for insurance, saving plans, and credit unions. So Beth, welcome. Thank you for joining us on short notice. I assume you're familiar with section 5. So I give it over to you to tell us what's going on here and how many people are impacted and financial implications, et cetera, et cetera.
Great, thank you. My name is Beth Fastiggi. I'm the Commissioner of Human Resources for the state of Vermont, and I noticed that Clark Collins, our Director of Benefits, is also here with me today to testify. H159 includes a section in it enabling the Northern Borders Regional Commission to buy out of the state employee health insurance plan. Earlier this session, Representative Kimball reached out to me to see if we could explore this issue and any costs related to the state related to adding this group onto our insurance plan, our health insurance plan. We have currently with our health insurance plan, we're a self-insured plan. We do have other special groups that buy into this plan, including from the VSEA, the State Employees Association, the employees of the VSEA. So for example, like Steve Howard, he's not employed by the state, but the VSE employees can buy into it. Also, the Vermont Arts Council, they can buy into our plan. So we researched any issues related to adding this group to our plan. It's a very small group right now. There's a handful of employees.
Yeah,
They don't expect it would ever grow to. It seemed like more than 15 or 20 employees. So which is a very small group in relation to our large plan we insure about between employees and retirees are in the range of like 24 to 25,000 members, including people's dependents on that plan. So it really, that small number of people really shouldn't have an impact on our plan. That said, we are a self-insured plan, so any individuals experience, if it's, if they have something very serious health issue, that can impact the plan because just because of the way a self-insured plan works. But because this group is very small and kind of in line with what we've seen with other people, other groups that are added onto the plan, we really don't have an issue with it. The expense of adding them for my department really would just be related to sending the organization the bills to pay for it. Just so it's just billing and a little bit of communication, which really is not anything that's material that we could easily absorb within our existing workforce. So costs to the state are really extremely minimal. So we can support, the Department of Human Resources can support adding them onto our health insurance benefits or employee health insurance benefits. The only thing I think the Legislative Council can probably confirm this, but we just want to make sure that it doesn't, I don't think that this would be, this group would be eligible for other post-employee benefits, which is considered the OPEB. We're always concerned about our retirement liabilities, and it doesn't seem like this group would be adding into our retirement plan or impacting any OPEB retirement liabilities. On my brief reading of the bill, we haven't done a deep dive, but I expect that Leg Council will have already done that work.
So I'm only concerned about the precedential value here. I mean, you've got the Arts Council, you've got now the Northern Borders. The Northern Borders, is that, I'm not all that familiar with it. Is that a federally funded?
Yeah, yes, it is.
I thought-
And
I
it's
thought-
sort of like USDA. I mean, they will be giving grants. I mean, they help finance a bunch of things in Vermont.
Are they federal employees?
I
Why would we be insuring?
No,
Federal
they're not
employees.
federal employees for that purpose. You'd have to have him come in. He's the chap who runs it is a constituent of ours, a new constituent of ours in the woods in Reading. And they are insured. Their other regional part, this is the Northern Borders one. I think Beth and Clark, there are like 5 or 6 of these regional commissions. And
There are other ones across the country, and we did meet with the executive director, Rich Grogan. Clark and I met with him a
right.
couple of times, and to discuss kind of the makeup of the group. And it is federally funded, and what they do is they basically vet grants and grant proposals for kind of upstate New York, Vermont, New Hampshire, and Maine. So the federal government provides money for economic development projects in these regions, and this group and each state that they're managing, I think, basically has a seat on the board. So each of the governors is on the board, and then the group distributes the funds and works on the projects that they're doing in that northern region.
Right. And they have this arrangement in some of the states where they work in some of these other commissions. They do not get federal benefits, though. That is I mean, they may be federal employees. Is that right, Clark? I mean, I see somebody nodding their head. I don't think they get benefits, or they wouldn't be coming to us to ask for them.
That's correct. They do not receive federal benefits.
Do they have health insurance presently?
They do.
Where do they get it? Just in the marketplace, commercial
Yes.
insurance?
I believe that's correct.
And are they federal? They don't get federal benefits, but are they paid by the federal government?
I think through the grants for the program, the person I had worked with at ACCD in discussions on the program previously was Ted Brady. I did put in a call to the new Deputy Commissioner Tate Brooks, but I didn't have time to talk to him about any more details regarding the group. The when we first hired the executive director, for until they could set up the organization themselves and get some employees, we actually hired the executive director as through the state payroll system, and he did receive state healthcare benefits through that system for the first, I don't know if it was 6 months or a year to set up till he set up the till he was able to set up the organization and then buy the benefits. And get that started and the whole payroll started for his own organization because it was a new startup a few years ago.
Right. And he has just moved to Vermont to run it, which is great. But I'm trying to find my notes on our meeting with him so I could help answer. But Ted was the real liaison with this. Tate sadly probably won't be up to
So if there are
get on
15,
it, but
if there are 15 people here, or that close to that amount,
It's
are all of them Vermonters?
No, they, I think at this point, I think they're mostly working remotely and they're working throughout northern New England.
yeah, I believe they're all in northern New England, but the entity is anchored. I believe the entity itself is anchored here in Vermont, and the executive director is here. But we could have him come and chat with us. He's very available.
I think we may have to. I mean, I'm a little nervous of what other groups out there that are in similar situations may want in, and then we're going to say no to one group and yes to another. I'm particularly concerned about the fact that we're allowing non-Vermonters into our insurance pool.
When I did speak with
This way.
Mr. Grogan, sorry, Senator Clarkson.
Sorry, Beth.
Oh, no, it's okay. It's hard. It's hard on Zoom. When I did speak to, one of the things that we did thoroughly vet was kind of this similar groups arrangement with other state entities and the states that they were in. So this is somewhat of a common arrangement for these regional commissions, and they do seem to attach to one of the state governments where in the region where they are operating to use some of those benefits.
So do you have you looked at the landscape out there and looked at groups similar to the Arts Council that might want in? We have a lot of, it seems, councils out there, and is, I'm just wondering from where you sit whether that's going to become a trend and whether that's a problem. Anyhow, if you could give that some thought, and especially you said you need to check on whether there's any toehold here towards other retirement benefits being the next request, or somehow this would, I assume this language is tight enough that it wouldn't allow for that. But if you can double check that, you said.
I will.
Yeah. Okay.
Yeah.
Okay. Any other questions for Beth or Clark? Thank you for being here, Clark. Do you have anything you want to throw in or add to the discussion at this point?
The only thing I did want to add is that because we are a self-funded plan, and I won't get into the total nitty-gritty, but we do have what's called stop-loss insurance, which means that any claims that would come in, even sort of the worst-case scenario, there is a cap to how much it would impact our plan. So there is some mitigation built into our self-insured plan that does limit the impact, sort of worst-case scenario impact of any lives that we take on.
Okay. Have you, when you're asked to have a new group join like this, is there any like screening done that there's not like a person in there that's going to bump up against this stop loss right away? Or are you not allowed to do that?
I do not believe we are allowed to do that, but no, it is not something that we commonly do.
Okay.
And how many groups, Clark, do you extend your insurance to? Because there are quite a few, like they're 10 or 12. I mean, they're quite a
No,
bit.
it's smaller than that. Right now, the only groups we offer it to are the VSEA, the credit union, Vermont State Employee Credit Union, and the Vermont Arts Council. Those are the three. The Vermont Historical Society used to be among the special groups, but they backed out of that. So it's just those three.
Great, thanks.
Okay.
So
Thank
I'll
you for
get the
being
contact
available and short.
Richard Grogan. It's Richard Grogan, right? Yeah, in Reading.
Okay.
Got it.
Thank you much for being here on short notice. Appreciate it.
Thank you.
Good to
very
see
much.
y'all.
Yeah,
you.
great to see you, Beth and Clark. And okay, more to follow.
Next, people we have available to us are Josh Hanford and Jen Holler. Do either of you have I know I'm grateful that you're here on short notice. And there's a lot to talk about in housing once again. So between the two of you, is there somebody who has a deadline or need more appropriately? I'm guessing that Josh has a little bit more detail than you might have at this point, Jen, but
Yeah, I'll
so,
defer to Josh, and I'm sure his schedule's probably more demanding too.
okay, let's do that. Josh, welcome. Thank you so much for being here. I, for one, I think it was yesterday when I first read a memo from Kendall Smith, learning about some series of new infusions into housing. I'm going to try and pull up that memo. You're probably familiar with it.
She sent it to every legislator. It was Tuesday afternoon late, I think. If you look under Kendall Smith, and it has a chart attached to it that has the big picture area, the big bucket.
I'm sure Josh is very
Just
familiar
say
with
for
it.
the rest of us that
Right.
what to
So
look for.
if we want to pull that up, we can. But Josh, why don't you just launch us in? I think things are happening very quickly, and start with the 60,000 foot overview, and we'll drill down to the individual appropriations being suggested both for FY22 and beyond.
Sure. Well, thanks for having me in to talk about this so quickly. Josh Hanford, Commissioner, Housing and Community Development. I think, big picture, we know that this pandemic has had incredible impacts on housing in Vermont in a number of ways. We know how important having safe shelter is to the health of individuals and our communities. And we've adjusted, best we could in this emergency to address the sort of acute housing issues we have. We know that we still have over, 2,000 Vermont households living in hotels and motels right now that are homeless. We also know that the price of homes has skyrocketed in Vermont, essentially pricing out, from my research, most middle-income Vermonters from purchasing homes. And so we have these sort of dual problems that we need to address, and we need to address quickly. The folks living in hotels and motels, that is not sustainable. It can't go on forever here, but yet we can't just kick people out into the streets. The FEMA's been paying for a lot of that. That's going to come to an end. These hotels and motels are going to stop. We're already seeing it, renewing their agreements to house folks as the economy opens up. And we're going to spend close to what we've proposed here to build housing just on nightly shelters over the next year or two if we don't do something to increase housing, to build housing. This is all money for capital. So this is a $249 million proposal from the flexible ARPA funds. It's one of the largest proposals in the governor's plan to bring on 5,000 units of housing by the end of 2024. It's pretty comprehensive and collaborative. It's really a strategic sort of plan to build new housing, rehabilitate distressed and underutilized properties, transition homeless to sustainable, safe housing that we can afford as the state. This plan responds to the affordable housing crisis exacerbated by the pandemic. It provides real solutions to the demographic challenges facing Vermont. We know that new construction of housing produces instant economic stimulus. It's proven to have one of the highest economic returns on investment, and it's got lasting measurable benefits. Adding additional housing stock will help stabilize housing costs and provide opportunities for Vermonters to build wealth. We also know that a number of communities have been planning for the new housing needed for years. We've funded so many plans looking at what the housing needs are, where they could develop it, where the locations are for decades, really. But we've never had the housing resources to fully implement those plans. The housing revenue bond helped us a lot, but there's a lot more housing development that is already planned for and ready to go. We have the housing organizations, the community partners, folks that are ready to address this need, both on the emergency rapid housing needs for the homeless, as well as permanent mixed income housing. We have, home builders out there, developers that are ready and able to leverage the public investment that we're offering here to build this housing, including this missing middle housing that we desperately need. We have all the state agencies talking to each other like never before as a result of this pandemic. We have our regional partners and planners on board. We've been working with everyone for a while now to better collaborate, sort of remove barriers that exist, and coordinate. And so we think we're ready for this sort of once in a lifetime opportunity to build homes that we need and work quickly on this. The plan, as it's laid out, has sort of the first year as addressing mainly acute housing needs, we're calling them. And this is the largest investment because in the first year, we don't have as much time to leverage sort of some of the existing federal, state housing resources out there. We need to immediately increase shelter capacity. What this is it's adding housing units to some of the shelters that exist, and we know they're going to be needed in the future. So let's build safer, more stable housing rather than depend on sort of the congregate model with bunk beds in a room. And that's a small spend at 12 million to bring on 150 units. The next is sort of a continuation of a lot of what we've already been doing. A large part what VHCB did with the CRF money, which is sort of rapidly bring on emergency housing by utilizing existing properties. Some of these are motels and hotels that can be converted to permanent housing. Some of these are existing properties that can be repurposed for housing in fairly short order. And we have $90 million dedicated to that to bring on 600 units to help exit folks from motels in the next 12 to 18 months. So those two areas, that's bringing on 750 units, probably more than 1,000 households could benefit from those. 1,000 Vermonters can benefit from those units, quickly help move folks out of those hotels, motels. It's a higher unit spend than the rest of the housing because there's less time to leverage and less other sources. We need this deployed immediately. We don't have time to wait. And then you go down the list in the first year, there's also a $20 million spend.
Can I interrupt you?
Sure.
Just to, I think, slow things down a little bit. Let's talk about these first two items a little more. Can you distinguish those two units a little clearer for me? Is the increased shelter capacity money that's going to be given to the shelters to reconfigure the shelters or build add-ons, or are they going to be converting other units out there? And the money, it's very similar to the rapid housing for homeless, except you're following the dollar to a different location.
Right. All those above, all the solutions. And this is also part of what VHCB has been involved in with the CRF money. There are some opportunities on site for some of these shelters to add units. You know, there's some, maybe there's a home across the street that they can manage. There's lots of different solutions, but the difference here is the money, the owners of those units will be the shelters themselves. It's not owned by the sort of typical nonprofit housing, organizations we have, or other affordable housing property owners across the state. It's connected to the shelters themselves, and it's adding capacity. You know, we are. This is a great opportunity to really, try to end homelessness, but or at least make it short and temporary. But we're always going to have a need for emergency housing, and if these shelters have safer opportunities to house people because of this funding, that's what we want to do. We want to provide this emergency housing sort of solution on site, integrated with those shelters, because they really serve people in crisis, and they serve them immediately. And so this is part of the solution. These two areas have really been worked on collaboratively with the folks at Agency of Human Services, Division for Children and Families. This is their numbers and their proposals to try to help exit folks from the motels, reduce our reliance on the general assistance spend we have right now.
Can you, on all of these, by next week at least, could you get us a brief history of the monies we put in already to meet these goals? I mean, this seems like an add-on to add-ons to previous monies that we've already done to address homelessness in terms of converting motels and stuff and things like that. I'm not questioning at all the need. I'm just wanting to know where we are in the process and what we spent so far, or what's still out there with other funds, just to have it in one place. It's almost like I'd like another column here for FY21 or FY20, what we dedicated in CARES funds or FEMA funds or other things towards these goals. Neither of these things are new. This is just a continuation. So I just want to have in one place the history.
We have a matrix like that in the works.
Right.
Jen's nodding. We were looking at it last night. It's very large, lots of information, and it's we already have a task of delivering a report to the legislature on this sort of spend and recommendations by the end of April. So I don't know. We probably will be able to send you this matrix with very large numbers.
Put draft all over it, just
to show you what's been spent, but we won't have the sort of narrative to go along with what our recommendations are and all that detail. But we can send along what's been allocated since the beginning of this pandemic to all of these purposes.
Right.
So I'm not, and I'm just to be clear, again, I want to stay a little bit at this point at the 60,000 foot view. I think, for instance, in the bill, was it the December 27th money that Joint Fiscal authorized? They did 110 million for Richard Williams program, and wasn't there like 16 million or something for homelessness in there? So I'm looking at these, these not as much as drilling down to the details of what's been spent to date, but what's been appropriated to date.
That's this matrix that we're working on, because there has been a lot, and we're gonna spell it out by, what's capital, what's for rental assistance, utility assistance, homelessness, which source it was from, because it's been a lot. There's a lot. It's hard to keep track of every time we turn around, there's a new federal stimulus bill that has funding directed towards various housing needs.
Yeah. So, I just want to make a slight detour here, but I think it's an important one. In finance yesterday, we were dealing with broadband, and the issue came up late in the day with all this money for broadband is how we were going to find the workers to do the work, to string the wires on the poles, good paying jobs, but do we have the ability to do this so rapidly in terms of the capacity in terms of human power? And we heard a lot about the pressure on the department in terms of getting the money out the door and having to pay top dollar for it because everybody's competing for construction projects. Even the average Vermonter wants to, they're trying to spend some money and they're sitting at home and they're trying to hire contractors. It's one of the busiest professions going at this point.
Yeah, I've got a couple comments on.
Is there a group looking at that, saying we have all this money now, we want to renovate all these motels, we're going to find the people to do it, to do the work?
Yeah, I've got a couple comments on that it's absolutely true. I've heard various, reports of different committee members, talking about this, and I know I'm trying to replace my deck that's rotting out and lumber's, up 128%. But the answer, we don't really have a choice. I mean, we have this money with a short timeline to spend it. We're going to be paying top dollar. And in my view, if we don't move fast, it's going to be a worse situation because every state around us is getting the same kind of money. They're putting it into construction projects and the competition is going to be fierce. We serve ourselves best by moving quickly. We have a pipeline of affordable housing projects. If we get our projects out to bid first, we're in better position. There's no question things are going to cost more, but I don't think we have a choice. We have people, we're going to spend this money on nightly shelter or we're going to spend it on building housing. And if we don't move quick, it's going to cost more each delay. The other issue is people are putting real thought into this. I know a couple large general contractors that work with affordable housing, and they're all meeting and talking about how they can coordinate, how they can not look at themselves as competitors, but how they can collaborate, bid on projects together, think about bulk purchasing of materials. So everyone's experiencing this. And, on the worker issue, the trades, we all know that we have a shortage. Our hope is that we get some of these projects out there. We get maybe other construction companies, others to come to Vermont to work on some of these projects, and they stay and they help continue our build out over the next 4 years, because we're all going to be in this situation for 4 years with this amount of federal stimulus in building. And so we've got to attract people. We've got to act quickly.
And it's
Can I throw in a question?
Senator Brock, go ahead.
Just a comment at this point as food for thought. This problem doesn't just exist in housing. It exists throughout our entire workforce. And if I talk about what I hear from employers more than anything else, more than any subject, it is the absence or the inability to hire people to do work. And maybe let me suggest something heretical for us to think about. We pay people not to work. Maybe we should think about paying people to work. In other words, the notion of premiums to work in Vermont in places where we have shortages of people, that's a heretical thing to think about. But we are in, as Josh mentions, this competition with other states, and we have an absolute lack of workers to do work. And maybe that notion of paying people to work as a premium is something that we ought to be thinking about.
I hear increasing minimum wage. All right, I hear all sorts of good things there.
No, I'm talking about a premium for jobs that need to be done. I'm not talking about.
I know. I'm just joking. I also think this is an opportunity for us to be partnering in a really productive way with our CTE centers and juniors and seniors, getting them apprenticing right away into the construction businesses. So I see that we want to be really using this as an opportunity to do that work as well, because we have young people who are ready to go and who are training at the moment on this, who could be used effectively as apprentices on a lot of these projects and build out their contracting skills and their professional skills for the future.
Well, we do have in 159, there is a section. It's a pretty,
Yeah, the work.
I guess it's a pretty unaggressive addressing of CTE at this point, but we could, if we feel strongly, whether it's broadband or this or everything, as Senator Brock says, it seems like, especially if there's a way to channel some of this money towards human capital,
Yeah.
we need to do that. It's a parallel course, because it's great largesse from the federal government, but if there's nobody to do the work,
Oh,
it's
absolutely.
a stall,
And the problem is that challenge is going to exist for 4 years, because this money is with us for 4 years. So it's not like the prices will go down in a year. There'll be a steady push on this investment in all these states for as long as these monies are flowing from the federal government. But it could be a win-win-win there, Mr. Chair.
Yeah. And so we invited Sarah Buxton and Dustin Degree this morning. I don't know if they're going to be available, but we'll certainly have them in next week. But I think sounds like there's unanimity on this committee that we might want to spend some good quality time on workforce development,
Absolutely.
in light of ARPA. So I'm sorry.
I mean, I think naturally with some of these projects going out and, more dollars flowing than ever, you're going to see people moving towards the trades. I mean, when they're paying people $25 an hour to stand there and help hang drywall, people are going to move to that work. Young people that have other summer jobs that pay nothing close to that, I know we need to have programs in place and, move workforce development. But sadly, I think some of our systems are going to be behind the demand, and people are going to naturally move there when these wages are upped, because they're going to be competing. And I want Vermont to be in a position that we're out of the gate quick, so that we can get people to work here. And the other issue, I know it's probably going to come up as another concern of mine with this rapid proposal to build housing, is, are we going to get in the way with, permitting and, Act 250 and whatnot? And you've seen the governor talk about this proposal. We have example of affordable housing projects that NIMBY appeals of Act 250 have been delayed for years and years. We will completely miss the boat here. We will not have a chance to do these projects and simple things. One of the challenges that I'm just, my head hurts from thinking why this is an issue. We have some of these conversions from motels and hotels to permanent housing. People have already been living there permanently for over a year, but when it converts from a motel to a permanent housing, they often have to go through Act 250. You can have someone that appeals it. The impacts have already been felt on those communities. There's already kids in school. There's already traffic. There's already all of the community impacts that have been in place with no permitting. I don't know what we're, risking or what we're holding up for helping people have a home and a dignified place to live, that we want to put these projects subject to those concerns and those appeals, and open up that chance of NIMBY to really prevent people from moving to a permanent housing. So that's just a marker for yet another concern of how to move this quickly and take opportunity that we have here to build the housing we've needed, but we don't have 10 years to work through each of these projects. So would you like me to continue down the other
Yeah,
three?
I would. Let's get through this chart of the
Yeah.
expedited affordable VHIP and home builder program, and then we'll take a break at around 10 for 15 minutes
Ooh,
and have you
that would be welcome.
come back if you can. Okay.
So the third bucket is what it was essentially committing to fully fund the affordable housing pipeline of projects that are out there. You know, as Jen would say as well, you know, these projects typically go through years of planning, pre-development, and then there's many years of seeking all the funding and getting it in place to deliver these projects. You know, they line up with all the various tax credits, VHCB, CDBG. What we're talking about with this money dedicated, we can fill in some of those other soft sources that typically will take 2 or 3 years to fill out the funding mix and get them underway. We have many of these have been planned, they have permits, and they would just be waiting for years for their turn to come up in the pipeline for funding. And this consists of, you know, mixed income rental properties, home ownership, manufactured housing, you know, mobile home parks that need help and infrastructure, improved farm worker housing, to name a few. So there's a $90 million investment in that bucket. Many of those projects also have the overall goal of, you know, 15% of the units dedicated to also serving the homeless. So this bucket as well helps to transition people from the emergency housing situations they're in now, and ultimately save the state money and have sustainable housing we can afford going forward. The third bucket is continuing VHIP, the Vermont Housing Investment Program. You know, we have over the last 7 months with this program, with CARES Act funding, already brought on 250 units at an average of $22,000, $23,000 a unit. About half of those are serving homeless people with that commitment. You know, this is helping primarily private owners of vacant and code deficient rental properties, bring them back online, providing safe, healthy, and affordable housing with low income ongoing affordability requirements that come with that money. And so we're proposing 15 million of this money to go towards that program, to bring on over 680 units through that. And then the last is sort of a new.
The bill that we passed, Senator Clarkson had how much in one time?
3 million.
So you're suggesting an additional 5 for FY22?
Correct.
Yes. So it would be 8 million. So you're talking about that number of units for $8 million.
No, this 680 is just based on this 5 million. I mean, I think this is the challenge that we all have, and clearly you guys are in the middle of it. You know, before we knew about ARPA, we had all sorts of one-time funding availability because of our budget. We had leftover Sierra funding. So, you know, in the governor's FY22 budget proposal, we tried to address many of these same issues, you know, added funding to VHCB, added funding to VHIP. Now we have this additional funding opportunity, and, you know, where all this shakes out is what we're going to be talking about until the end of the session, I assume.
Are you talking about the same size grants of 30,000? Because we were only talking with $3 million. We were talking about 100 units, 120 units. I mean, to have 680 units out of only $5 million.
No, it's 15 million.
It's 15 million. It's over 3 years.
Oh, it's over 3 years. I was just looking at the 5 million for this year.
Yeah, we're talking the same size grants, you know, up to 30,000. They've been averaging about 22, 23. The piece here is that there's also support in some of the climate change buckets. We've had lots of meetings with Agency of Natural Resources and Public Service Department that they have added incentives to help address their goals. And, you know, when you're in a home, you're renovating it, you know, one of the last things they might do, they do weatherization work, but they might not switch out their entire heating system, for example. They may add a more efficient boiler or something like that. They want to add an incentives that would make it feasible to do fuel switching at that point. Make it all, heat pumps and electric by adding, possibly a $5,000 grant on top of this, but it comes with those energy efficiency, climate change goals, which could be an option when we're in the home doing this, that maybe these property owners might not take that extreme of a sort of approach because they're going to have to borrow that money, where if there is an added incentive. So I guess what I'm roundabout way of saying, this is $15 million to bring 681 units online, calculated separately from all the other proposals around this that you've already got in front of you. And in addition to that, there are other anticipated incentives to do even more weatherization and more sort of climate change adaptation coming from other sources in the governor's proposal that could enhance this program.
Okay, let's go on to the home builder program.
And the last one is really recognizing that, we have really, middle class homeowners have been priced out, or the chance to be first time home owners in Vermont. Working class Vermonters, we've seen an influx of folks moving to Vermont full time and vacation because of our success, but that is having an impact on folks being able to buy a home here and live here. And we need to do something about this. We have a great system in place to sort of build affordable housing. We have a great network, and folks at the higher income, they're able to get a home built. They're able to find a place that they can afford, but the middle income has been squeezed out. And we really haven't been building enough homes in this sector since the 80s. I mean, we can go and look at the building permits. We have them with the data VHFA has collected, that we literally have not been meeting this demand for decades now. And with the uptick in housing prices and them being snatched up, if we don't do something to incentivize more missing middle housing to be built, we're going to be decades behind. And I'm afraid that, Vermonters that have been working hard, have good jobs, are going to look at their future in Vermont and say, I'm never going to be a homeowner here. I'm going to move. And we cannot lose this population to that dynamic. And so this is meant to be a public-private partnership that essentially is incentivizing home building, but it's incentivizing them to bring these homes online at a price that middle-income Vermonters can afford. This purposely doesn't roll out, until the second year, essentially, because we have to develop what this looks like. We've never done anything like this in Vermont. So it's a new program that we have to bring, industry folks into to help us develop, some of the guidelines, but, it's based on a certain incentive to bring down those home costs, with a goal of 1,100 units. And we'd also try to, we'd like to have some special incentives here, like we talked about in VHIP on the homeownership rehab piece for BIPOC community, and others that, have not had the opportunity to be homeowners at the same rate as white Vermonters. So this program is something we want to work with a lot of folks to develop how it works and what it looks like, but we hope folks share the same goal. So I will stop.
So in the larger scheme here, you're talking $42 million over 3 years would produce 1,100 additional units. Is that correct?
Correct.
I know it's rough. Okay. What is the $2 million going to be used for in FY22?
Under this, it's to get the program started. It's just an estimate that if we got authority to start this day one, there's a couple low-hanging fruit projects out there already that we know about that are going to be bringing homes, and their goal is to bring them in at the same affordability levels. And if we had this sort of incentive available in year one with $2 million, we estimate we could get that number, 55 units funded in year one, with the similar goal as the home builder program. But the majority of this rolls out in years 2 and 3.
Is there anything in writing that describing this program? The home builder?
Not in detail.
Okay.
It is a concept that I've heard many talk about and ask, and there are programs. This is done sporadically with our affordable housing partners over the years. Some of these projects have, are sitting on the shelf now. In Woodstock, they haven't been able to build the rest of Safford Commons. They need more incentives for homeownership. There's a project in Randolph that's also been looking to build 20 affordable homes. They already own the property. There was a rental property, affordable rental that was built there, but it's been stalled because in our system right now, we don't have an easy way to incentivize home ownership funding between 80% and 150% of AMI. The HUD programs they cap out at 80%. And we have the shared equity model, but that often has more investment needed to cover that equity that you're sharing over a lifetime of that home. This is anticipated to be a lower investment per home, and bringing down the ultimate sale price that the builder is delivering it to that affordability target that we're seeking.
So I'm going to let people take a 15-minute break. But before we do, I'm envisioning in this thing that there may be existing programs already that we could pump more money into that could produce this middle income housing. I'm thinking most specifically of the down payment assistance program. I
think we're focused on production. The down payment assistance program. Well, now, there's not enough stock. It's just driving up the costs of the existing homes. We need to incentivize building.
That's what I was going to say, that there's two different approaches. One gives money to people to make it more affordable to them. The other, I guess, gives money to the building community to make the house more affordable on the market. But it's really not necessarily driving down the cost of building a house. It's just driving down the price of that house.
You're subsidizing the cost of building the house by, helping them purchase the land or cover permits and infrastructure, so that they're committing to a delivery price that we agree is affordable.
Okay, good. Thank you, everybody. Thank you, Jen, for hanging in there. And Beth, we'll be back at, check the time here, 10:20.
10:20? Okay.
10:20.
Thank you, Mr. Chair. I just need to go to another committee to testify at 11.
Okay, thank you.
It looks like